Let's go to this conversation now. Gift of the Givers Imtiaz Sooliman is warning of malnutrition crisis in South Africa. Now, the COVID-19 pandemic has further exacerbated the inequalities, with calls to address food security growing louder and louder. Now, the United Nations Children's Fund says in the absence of decisive and timely action, COVID-19 will result globally in a 15% rise in the number of children needing critical nutrition services. Dr. Imtiaz Sooliman, founder of Gift of the Givers, joins us live now. Thank you so much for your time, Dr. Sooliman. Let's start with, because you're always on the ground, paint a picture for us of how bad it is.
Good evening. The picture is bad. You monitor that by the number of calls and requests that you get for assistance. That's the best way. And for the last few months, in fact, for quite some time post-COVID, it was during COVID, but post-COVID, we're getting calls for more soup kitchens from many parts of the country, large parts of the Eastern Cape, especially rural parts of Eastern Cape. And then, of course, from Northern Cape, the calls have been pouring in, the emails have been pouring in, again, very, very rural. Quite a few parts of Free State, especially on the eastern side. The requests for the number of people coming to a soup kitchen, so before it used to be like once a week, now they need to do it 4 or 5 times a week. It used to be 100 people, now it's 300 to 400 people. The school principals are telling us that the kids that come to school, that's the only meals that they have. When they go home, there's no meals for them, and there's no meal for the parents. And another large category of people are university students from all over, and the hunger crisis has been growing among university students who say they got academic tuition, they got their textbooks, they got their transport, but they got no food and they can't concentrate. And the other emerging phenomena is hunger in the middle class. A lot of people have lost jobs, have taken a deduction in income, but there's a joint income, the cost of inflation, the interest rates, the fuel price. So they have less money to buy food and to pay for school fees and other such items and healthcare. And you find that there is hunger in those homes, but because of the status, being middle class and not lower class, a lot of people sit and suffer in silence because of that hunger.
And when you then are listening to some of these calls that you then would be receiving, I mean, you're saying that people are asking for soup kitchens to be about 4 times a week instead of 1. Is this an admission by them that there is no help at all on the ground? What is happening in terms of some of the responses that government should be putting in place to be able to assist there with food parcels or something?
The strange thing is the government that's calling us. Quite often it's mayors and councillors that are quite honest and say, June, you know the situation in the country. Municipalities are dysfunctional. They say it's not a secret, it's a fact. Lots of municipalities are bankrupt. We don't have the means. We need support from central government, but everybody needs the support from national government. All the big institutions, the SOEs, everybody needs help. And they said, look, we've lost a lot of jobs and a lot of industries have closed. And there's no new industries coming in our areas. So our people are at the mercy of handouts. And a lot of people, especially in black communities, their family members from other parts of the country would send money or would send food. But they've lost their jobs, or the income is curtailed, or the expenses have increased. So they have less money or less disposable income to buy more food for those areas. So the municipalities are helpless. The people are helpless, the family members are helpless. It's just the donors and those who have means, the generosity of those that are keeping these people sustained, of course, and the need is growing. Until we address the unemployment and get more jobs created and have more money coming to the areas, this problem is going to get far worse.
How then do South Africans begin to respond to this crisis? Because if you're even getting calls from government, it tells you just how dire the situation is on the ground.
Yes, South Africans have to start, the South Africans have done well. South Africans have gone out of their way to assist. But it will start in your own families, because quite often it may be even in your own family. It may be a cousin, a relative, and if everyone can take care of a few people, it helps. Check with your domestics, check with your staff in your work, check with the neighbors down the road and the community. We can't help everybody, that's the reality. But you can help those closest to you. Those who are family, those who are in the streets, in the neighborhood, and those who are in companies. We need to do that in the best way possible to assist, and of course then to organizations that are directly in the grassroots, helping men, women, and children. The other thing that we can do and this is a call to corporate South Africa, take it an extra salaried person into your employ. Take youth, and give them a stipend and give them skills and introduce them into your company. It will not only be about giving them a stipend, it will be about giving them self-esteem, giving them skills, giving them experience, giving them trust in themselves to make a start. And it's a business expense. So all corporate companies, we're asking in South Africa, employ one youth. A youth plays a role in a family, and let's try to do that. Even in the farms, I was at a conference on Friday asking farmers also to take in youth and teach them and give them skills. And with farming skills, of course, you learn agriculture. What agriculture? You learn planting of food. But planting of food, there's food security. So while there may not be money to buy a range of items, but with different seeds and different plants and different crops, you at least can have something to sustain yourself, to prevent illness and malnutrition from lack of food and from food insecurity. Those are the kind of things that we can do in the country where at least somebody has something to eat at least once a day.
And Dr. Sooliman, in light of all of this, I mean, you're thinking about parents who've lost their jobs, and as you say, some of them are too ashamed to even ask for help. You think of university students, you think of some of, people in communities. What is the situation like with the little ones, the children? How bad are things there?
It's very critical. Up to right now, the kids have been dying of malnutrition, especially in the Eastern Cape. If you check with the hospitals, you check with the health department, you check with the doctors, a lot of children have been dying from malnutrition, especially in rural Eastern Cape. And when you ask why, it's heartbreaking. They die because for adults, it's quite normal to be hungry. Hungry is the norm, it's the standard, that they don't eat. And when they don't have food, that same hunger passes on to a child because they don't have the means to pay for food for that child. And they will survive. But the child will come to a clinic a little too late and come to a hospital too late, and the child will die because there's just not enough food and there's no patient education about the dangers of malnutrition. And we've partnered with the health department, with dietitians, to go out and try to educate people to say, this is a problem, you need to identify this early. But you can identify it, but if you don't have the means to sustain it or to feed, what do you do? Fortunately, we had what is called easy peanut paste. It's a product with proteins and micronutrients. It provides energy instantly for children and adults. When we started using it, the company that makes it is a Norwegian company. They saw the product on our social media pages, and it gave us 25 million rand worth of free product to assist people, and children, men, women, and children. We're very, very grateful for that. We're very grateful to corporate companies who bring maize and flour, and people who bring fruit and vegetables, whatever we can get. And even, as I said, if South Africans individually can do it in the areas around them, then we'll help in whichever way we can. Collectively, we need to feed, but there's a lot of hungry children. I mean, we're extensively involved in Eastern Cape, but I guess, and I'm almost certain with the calls we're getting from Northern Cape and parts of Free State, that this problem is going to expand. Hey, what about Western Cape? We've got 90 soup kitchens in the Western Cape alone. And we not be malnourished children like in the Eastern Cape and what we're expecting to see in the Northern Cape. But nevertheless, there's hunger even in the Western Cape, and throughout the country, more and more calls multiply. Please, can you give us a soup kitchen?
And I hope those calls are heeded, Dr. Sooliman, thinking about little ones who are really bearing the brunt of what's going on here and how desperate the situation is on the ground. And I do hope that things improve soon. Thank you so much for your time. Do appreciate it. That is Dr. Imtiaz Sooliman, founder of Gift of the Givers.